Welcome everyone to our program information session for our Masters in Surgical Science and Practice and PGCert in Patient Safety and Quality Improvement. We will go ahead and jump into our housekeeping items. First and foremost, this event will be recorded and you will receive a link to the recording in your email, or you'll be able to view it on our website. There will indeed be time for questions at the end, so you can pop those questions in the chat or Q&A function now or throughout the event today. It's very wonderful to meet you and to have you here today. My name is Olivia Lounsbury. I'm the Associate Course Director for the Masters and PG Cert programs and have my hand in a number of different buckets here in Oxford in terms of research. Tom, do you want to introduce yourself?
Thanks, Olivia. Hello, everybody. My name is Tom Revington. I am the course director for the Postgraduate Certificate in Patient Safety and Quality Improvement and the Masters in Surgical Science and Practice. I am also the module lead for the Quality Improvement Science and Systems Analysis module. Good to be with you.
Thank you, Tom. And last but not least, Pippa, welcome.
Good morning. My name is Philippa Brame. I go by Pippa. I'm a clinical professor in the Department of Obstetrics and Gynecology at the University of Calgary in Alberta, Canada. I'm also the medical director for Women's Health Alberta. I'm a practicing obstetrician gynecologist with a subspecialty in pediatric and adolescent gynecology. Good morning.
Thank you, Pippa. Thank you, Tom. And we will move into our agenda. So we'll talk a little bit about the two courses, the program overview for both. We'll touch briefly on our program faculty. And then we'll go into the nitty-gritty about who the course is for, how the courses are structured, and how you are assessed. Although, if past is profit, it's always quite good to hear from our alumni. And so we will hear from Pippa about how she has used concepts from the course in her own work. As I mentioned, if you're just joining, please do drop any questions into the chat or Q&A. Wonderful. So we will go ahead and get started with our program overview. So, Tom, I will pass it over to you.
Great. Thank you. If we can move on to the next slide, Olivia. So we've got some basic introduction to the course, just starting off with the fact that we've got these two different courses and a bit about how they both work. So the postgraduate certificate is a course that you can take over either 1 or 2 years. Probably most of our students take it in 1 year. But with both courses, there's flexibility over how long you take to do the course. So you can take 2 years. Both the courses are taught in person in Oxford. There is supporting learning that happens remotely, and we'll talk more about that as we get into the other sections. So with the masters, it's a longer course, 2 to 4 years. But still part-time and still taught in person in Oxford. If we can move on to the next slide. What's the intention behind the program? It's to help you understand better how healthcare systems work and to enable you to develop your capacity for leading positive change. It's designed so that it can be taken, both courses can be taken by people that have a lot else going on. So in particular, for people who are in full-time healthcare roles. So you're able to study alongside your career. The teaching, as mentioned, is in person in Oxford, but you'll see that we do that in 1 week intensive modules, of which you would take between 1 and 6 over the course of a year. Most people would be taking 2, 3, or 4 modules over the course of a year. So you'd be coming into Oxford for 2, 3, or 4 weeks, which is what enables you to carry on with your other responsibilities. The course is aimed at healthcare practitioners, those that want to improve their own practice, but also make a difference to the system that they're part of. We often hear that a motivation for taking the PG Cert or Masters is to support career progression. Um, and we often hear from our alumni about new roles that they have taken on or applications for positions that they have succeeded with, and that the Masters or PG Cert has played a part in that success. Um, and as mentioned already, it's designed for people who need the flexibility of a part-time course. Um, our overall summary of what we're intending to do is to provide you with the non-clinical understanding and skills that clinicians need in order to thrive in healthcare organizations. And we have a very broad range of geographies that people come to us from. We certainly have students that join us from the UK and Ireland, but as you'll see there, we have students that join us from every corner of the world, and that's something that really makes a big difference in our classroom discussions. We and uh, the ability to compare how healthcare is provided in different places around the world. So here is a summary of the entry requirements. There is more detail on entry on the University of Oxford graduate admissions site. Um, but in summary, for the PG Cert, what we're looking for is that you have education to a degree level in a relevant subject, but we're quite broad in terms of what that can be, and that you're currently working in healthcare. That matters for both the PG Cert and the Masters, because we are looking for both of these courses to be both academically rigorous but also practical. And one way that is built into the courses is that the way that we assess you is through inviting you to apply what you have learnt in practice. So you really need to be working in a healthcare setting to get the most from the course. Moving on to the masters, there's the criteria that are there. Again, what you'll notice is that we have the discretion to take quite a broad view on the clinical discipline that you're practicing within. The formal title of the masters is surgical science and practice, but the content is broadly applicable within healthcare. So certainly other technical procedural disciplines are welcome to apply. And we have had some students that are from other healthcare professional backgrounds. So, for example, one of the students I can see in that picture was our first nurse practitioner who joined the master's program. She was a nurse practitioner by background, but had a clinical governance role that was part of her motivation for taking the master's program. And in terms of what you will learn during the course, there's a lot more information on the website on each of our modules. But what you see on the left side are the six modules that are part of the MSc. So on the MSc, you will take all six of those modules. On the PG Cert, the first two modules there, quality improvement and then human factors, are mandatory modules. And then you have a choice from the next three modules. Um, if you're taking the MSc, having completed the taught modules, you'll move on in your final year to do a supervised research project.
Wonderful. Thank you so much, Tom. I'm very pleased to introduce you to our faculty, all of whom are nationally and internationally recognized in their respective fields. Um, I'll highlight just a few, but not to discredit others who aren't featured on these slides. We're very lucky to get to work with these folks. So the first person I'll introduce you to is Dr. Helen Hyam, who runs our Human Factors module. She's a consultant anesthetist and associate professor at the hospital here in Oxford. She did her own PhD on situational awareness in medical practice, combining simulation, human factors, and other research theories to develop practical tools and frameworks for improvement. And last but not least, she's the director of the Oxford Simulation Center. So does a lot of work in simulation and more recently in AI at the intersection of experimental psychology, human factors, clinical work, and engineering. The second person I'll introduce you to is Mr. Ryan Kirsten. He co-leads our Healthcare Innovation and Technology module, and like Helen, has an alphabet soup of credentials next to his name. So he himself is a consultant plastic surgeon and is the Associate Medical Director of Research and Innovation in his own trust. He is a prolific writer and is the technology editor and writer for the Royal College of Surgeons Bulletin. And quite impressively, really practices what he preaches. He's been involved with medical innovation for almost 20 years, has been involved in a number of different startups, one of which was a single-use tourniquet and has sold over 60 million units in 30 countries, which is really quite impressive. Tom, I'll turn it over to you to feature the last two faculty.
Thanks, Olivia. Yeah, and I'll let you have a read for yourself the detail. But what Olivia and I are hoping to illustrate here is that our faculty on the program are drawn from first of all clinical practice, but with a focus in one of the non-clinical areas that we cover on the course. So with Helen Hyam and on the previous page, that's human factors. And Ryan Kirsten focuses on innovation, but they're clinicians by background. In addition to that, we have academics. So Steve New that you see there is an academic focusing on how do organizations manage their day-to-day operations, not in the clinical sense, but in terms of running things smoothly and efficiently and providing a service to a high level of quality. So that's Steve's focus. As I say, he's an academic, but he's done a lot of work in healthcare, so he understands the healthcare world. Carol Pedden illustrates that we also bring people who have significant leadership roles in healthcare. You'll be hearing from Pippa shortly, and that's true for her as well. Carol comes from a clinical background herself as an anaesthetist, but her contribution in the program is really her understanding of how leadership works in healthcare, and how you can use a leadership position to bring about change and improvements in quality. This is here simply to remind us to make the important point that you will learn a great deal from your fellow students as well. This was one of our recent modules, and we have relatively small class sizes. This is probably one of our bigger classes that you're looking at here, probably somewhere between 15 to 18 students per class is our average. So there is plenty of opportunity for conversation and dialogue. So your fellow students are teaching you just as we as the faculty are hoping to teach you.
Wonderful.
And on that note, Olivia, I'll let you introduce Pippa.
Wonderful. Thank you so much, Tom, and a wonderful segue into hearing about Pippa's experience, particularly how she was able to apply concepts from the course in her own leadership roles, as well as how she was able to fit this course around more than a full-time schedule. So, Pippa, I will turn it over to you.
Thank you. Good morning. It's a pleasure to speak to you today. The PGCert course, which is what I completed in 2023, has been very influential in the work I've done since then and progressing my career, and I think highlights a lot of what the program set out to do. So if you don't mind, I'll take a minute to explain my journey to the course and then a little bit of how I've applied it in my clinical practice. So as I mentioned earlier, I'm a clinical professor in the Department of Obstetrics and Gynecology at the University of Calgary. I came into the program with that title. I had also had several leadership roles, including being the site lead for our tertiary center for 6 years, and was really looking to try and broaden my education and quality improvement. So the slide I'm showing you is where I live in Calgary, Alberta. And in the spirit of truth and reconciliation, which is a big part of the Canadian culture, I just would like to say I'm also speaking to you from the traditional territories of the Blackfoot Confederacy, the Tsuut'ina and Nakota Nations, and Métis Region 3. Just briefly, Calgary is nestled in the western part of Canada by the foothills. We have a very world-class trout stream, and the picture on the right side is my son with a rainbow trout caught last week in November in Calgary. So the mythology of us living in igloos is not truth to us at this point in time. So as mentioned, I had a number of leadership roles, and when you are a site lead at a hospital, you are also tasked with looking at patient complaints and quality concerns, for which I felt very under educated to do. So I had the opportunity to take a sabbatical, and I went in search for a QI course, for which in North America, there's several courses that are popular, but most require moving to another part of the country or even the United States to take, weren't very practical for someone who was practicing clinical medicine. And then I came across the course through Oxford and was really drawn to the flexibility of it. I chose to do the certificate as I had already completed a number of leadership courses, which isn't to say I couldn't have had more education, but for me, it made more sense to do the 2-year program. I actually finished the quality improvement, human factors, and my elective was the surgical innovation course in a year. And it was tremendously helpful to be able to go back and forth and have some flexibility when those courses happened. As a female in medicine, I think it's also really important to have the flexibility of a part-time program, especially if you're using this course in the early years of your practice to promote either for a position or for promotion in university. You're often juggling a young family, the clinical practice, financial responsibilities. And so being able to have some flexibility and timing was very important. I chose the course specifically for the QI component, but I've actually taken advantage, probably more specifically, from the human factors course and innovation. So I found all three of the courses tremendously helpful. Next slide. So just briefly, Alberta is a huge country, and for those who aren't that familiar with Canada, Alberta is the pink province. We have 10 provinces and 3 territories. Our healthcare is both federally and provincially funded. We have socialist healthcare in Canada, but the oversight of healthcare is a provincial program. So while I was completing the PGCert, I applied to be a co-chair of the Provincial Perinatal Quality Assurance Committee, which was the review of the provincial maternal mortality and perinatal mortality cases in the province. My appointment to that position was directly related to having completed the certificate. And then in about the last year and a half, we've had a significant change in the provision of healthcare, specifically in Alberta, and this was realigned to create 11 clinical programs in the province, for which one is women's health, and I applied and accepted the position as the medical director for women's health in the province, which is an opportunity to be very influential in both policy and change management. And specifically for me was to apply the human factors methodology to not only the assessment of maternal mortality, but also severe maternal morbidity. And in that role, I also represent the province nationally in our Society of Obstetricians and Gynecology in Canada, representing programs trying to reduce both severe maternal morbidity and mortality. So the program itself has been very influential in my progression of my career, which obviously is at a bit of a later stage, but I think would also be tremendously helpful to for applications for positions in academic centers if you were early in your career. So over the next couple of slides, I'd just like to briefly show you how I've applied some of the learnings into some change management, specifically in the work I do. Next slide. I have a subspecialty in pediatric and adolescent gynecology, and at the time of doing the program, I was the division head. We had a significant lag in the timing from referrals to our program and actually being able to be seen, which was over 2 years. And prior to doing the certificate, I had looked into trying to shorten that time. And during the program, and having understood from the quality improvement course, the ability to engage with quality improvement experts within your center. So as a practicing clinician, we're not going to come out as being experts in how to do all of the methodology of quality improvement, but we can also learn how to engage with the specialists that are available to us in our different healthcare authorities. So I engaged with the Alberta Health Service Quality Improvement Specialist, and with her support, we did a full assessment of our program. We evaluated the process of referral to actual patients presenting to our clinic, and we innovated some opportunities for some clinical pathways. Next slide. So we found that we could support family clinicians, nurse practitioners in working through some of the common problems that present to us as gynecologists in the realm of pediatrics and adolescents. And I've published and developed these pathways with a hub team, which was made up of family practitioners, nurse practitioners, and nursing. These are published on the link that you see there and are essentially clinical pathways, reference to guidelines and papers to support practitioners working through clinical problems. And with the aid of that and other things that we've done, we've reduced our wait time from 2 years to under 6 months, which has obviously been a significant improvement in patient care. Next slide. There's also some interesting little projects we've done in my practice. So locally in your clinic, this is a little pilot project we did using Entonox sedation in a clinical space for IUD insertions in adolescents age 15 to 18. And we've now implemented this as a routine part of our clinical practice. As a little aside, this costs $6.70 a patient, which in your world is about under £3. We presented this paper at the North American Society of Pediatric and Adolescent Gynecology. And as I said, has now become a routine practice in our clinic. And the final quality improvement project I'd like to show you, next slide. So in my role as the medical director for the province, I engaged with a team which is called the IHOT team, and Improving Health Outcomes Together, which is a provincial team supporting change management for clinical innovation and improvements. I also worked with the Physician Learning Program, which is also a provincial program supporting specifically physician learning. And with those teams, along with the colleagues in both transfusion medicine and obstetrics and gynecology, we've worked towards reducing the routine type and screen test in planned cesarean sections, which at the onset of the project was up over 85%. So all patients more or less having an elective section had type and screens. And with the initiation of this project, we're down at about 30% across the province. So that, and now we're looking at sustainment models, and this project was presented as a poster last week at a national QI conference in Toronto, Ontario. So all to say that I think the PG Cert course for me was really important, not only for my personal learnings, but opened up a huge opportunity to progress my career in both local leadership and provincial leadership, and has allowed some fostering of significant clinical change, and has reinforced with me that it requires a teamwork. And I think your comments, Tom, about having the in person and developing a team are really relevant to me. And that also, as practicing clinicians, this can be daunting, but there's a wealth of expertise available to us as clinicians that became obvious to me having done these courses. So maybe I'll stop there and allow some questions later if people have them. Thank you.
Gosh, thank you so much, Pippa, for sharing that. And what particularly stood out to me was the fact that you were able to quite rigorously blend the theory from the course with real world outcomes. And that's oftentimes what we hear is, a focus on the practical outcomes. How can this theory help my patients, help my staff, help me design better services? So I'm seeing the SPCs and the sustainment model and all the frameworks that we talk about on the course. So thank you for sharing that. So in our next section, we'll talk about the program structure and assessment. So I will take the former here in just a few slides. The key point in this is that the programs, both the PG Cert and MSc, are designed to accommodate full-time working professionals, those who have caring responsibilities, as you heard from Pippa. So each of the modules is centered around 1 week of in-person work here in Oxford. Now, that's not to say that that is the entirety of the module. Each of the modules will also have a 4-week period of prep work, reading, activities to do independently, and each of the in-person weeks will also be followed by approximately a 6-week period of further reading, working on the assignment, and collaboration with the peers and faculty that you met during that 1 week. So again, designed to accommodate busy work schedules. So each of the modules that you see on the screen here runs once per year, with the exception that you can see in the asterisks at the bottom. So the exact dates typically vary by year, but you'll see that the quality improvement module usually runs in October. Becoming a clinical educator runs in November. The dates might change slightly based on the year. But this enables folks who have to get their clinical schedules in several weeks in advance to be able to anticipate what modules they will want to take in year 1, year 2, and if you're doing the master's, year 3. So these modules can be taken in any order, again, based on what you have going on in other areas of your life. Which leads me to my final point here. So these modules can be taken in any order under what we call variable intensity. What that means, at least for the masters here, is in each of these bullets, you can see one example of a pathway for how these modules can be taken alongside of the dissertation. Ideally, you'll have taken each of the 6 taught modules for the master's program before you move on to the dissertation. And each of these 3 bullets shows a different pathway for how you could do that. So in example 1, you can see maybe in year 1, you opt to do 3 modules. In year 2, you opt to do the other 3 modules. And then in year 3, you opt to do your dissertation. I would say that's probably the most common. Another option is maybe you front load some of the modules in year 1. So you're doing 4 modules in year 1, and in year 2, you're doing maybe 2. And in year 3, you're focused on that dissertation. The last option, which I would say is probably the least common, but certainly happens, is doing the master's program within 2 years. And that might look like front loading 4 of the modules in year 1. And in year 2, doing the latter 2 modules as well as your dissertation. As you can imagine, that's quite rigorous alongside a full-time working schedule, but indeed it does happen. If you are taking the PG cert, it's a very similar concept for variable intensity. So you'll have three modules within the PG cert, and those three are usually taken over a 1 year period, but can be extended to two. So Tom, I'll pass it to you.
Thanks, Olivia. So as mentioned, each of the modules is assessed with a task which is intended to give you the opportunity to apply what you have learned to your own workplace setting. In the end, we are looking for a written piece of work which is academically rigorous, but it will be through application to some aspect of your own practice. All of our work is marked by two markers independently, who then compare and resolve any differences. And in the final year of the master's, the assessment is by submission of a dissertation up to 15,000 words, based on research that you have done over the course of that year with the support of an Oxford appointed supervisor, and usually also somebody one or more people that you have recruited locally to provide you with support in your workplace. That the research that you base the dissertation on can be from any of the six modules which we teach on the course, or indeed it's often a combination of more than one. And Olivia, as you said, I was struck also with Pippa, your example with the way that you were actually combining elements of a number of the modules. Quality improvement may have been the focus, but you were certainly bringing in aspects of leading change into how you approach that. We'll move on. And the course is offered by Oxford's Nuffield Department of Surgical Sciences. So there's a whole website that talks about the wider work of the department. And what you'll also find there is more information on the range of different research topics. There's really a pretty broad range of research that's going on in the department. And whilst if you're doing the MSc, your own research is going to be based on your own interests and what's relevant in your own work area. We do sometimes have students that are able to pick up on a theme that's being researched by the department, and sometimes the supervisor from one of those research areas will agree to supervise one of our students' research. We'll conclude by talking a bit about funding, and then next steps if you would like to explore an application. There's a summary here of some of the potential sources of funding. And whilst we do have many of our students who self-fund, there are a range of sources that you can explore. Oxford does have a number of scholarships, but as you might anticipate, they're very competitive. We will often have at least one of our students that has nonetheless been successful in getting a University of Oxford scholarship. Others are able to find scholarships from other sources. Sometimes there are national scholarship programs, or your organization may have funding for this kind of study. Particularly given our emphasis on putting learning into practice, there are real benefits for the organization that you work for. You'll be part of the Oxford College if you're an MSc student, and the colleges do have some discretionary funds to support students who are in some kind of financial need. Um, there is a lot more information on sources of funding on our webpage, so that's where to go if you'd like to explore funding further. Uh, we have three cycles of applications. The first one is usually November, then January, then March. So the first one in November is coming up soon. I can't remember the actual date for the deadline. But the advantage of applying sooner rather than later is that first of all, you might need to know for your own planning purposes if you've successfully been offered a place. The other thing to bear in mind is that for the Oxford scholarships, the January deadline is the latest point at which you will be considered for Oxford scholarships. But we then do have a later round in March, and if we have places available, we'll keep applications open for a month or two beyond that. Um, Layla is another Canadian who joined us for the Masters in this case. And you can see for yourself some of what she said about the course. She published her dissertation. That's what she's holding up on the tablet screen there. And was also given an academic role to go alongside her clinical role, which she would tell us was partly based on the work that she had done through the masters.
Thank you so much, Tom and Pippa. It's been wonderful to hear at least a whistle-stop recap of some of the core features of the course. I have a few remaining slides on where you can go to find more information. Before I get into these slides, now is the time to pop questions into the chat or Q&A if you have them. So we will be keeping an eye on that, so get those questions in. First and foremost, the best way to stay up to date on anything from application deadlines, to hear about events, to hear about new features from students, is to sign up for our newsletter. When you sign up using the QR code, or you can go to the website that you see listed there, or even email us directly, you'll be asked for your communication preferences, so you'll be able to tailor what is in your inbox based on what you are most interested in. The next point I want to highlight is the Oxford Open Grand Round series, which is a series of virtual events featuring core concepts from the course. It's open to anyone. So if you are interested in learning more about what you will learn on the course, or if you're interested in just staying abreast of what's happening in these different disciplines, I would highly recommend signing up for the newsletter so that you are aware of when these Oxford Open Grand Rounds events occur. Our most recent one was titled What's Next for AI in Surgery, and we had our two module leads, Matt and Ryan, which you can see there on the screen, as well as one of our previous students who has gone on to do a number of different things in the surgical technology and innovation space. So sign up for the newsletter if you are interested in hearing more about those Oxford Open Grand Rounds events. Without further ado, I will move on to our questions. So first, I see one, and maybe Tom, this is a question I can direct to you. Is the MSc suitable for doctors completing foundation year training in August next year? So 2 years post-graduation from medical school for those who are outside of the UK.
Yeah, thanks for the question. You do meet the formal entry criteria, which is that you have 2 years of experience in clinical practice. So we'll definitely consider your application. I would say that it can be harder to demonstrate that you have already taken a significant interest in the improvement of the system that you're part of. One of the things that we look for is that you show some demonstrated interest in the kind of topics that we teach on the program, and that you've got the ability to apply in practice what you're going to be learning. That is typically easier for you to do with a few more years of clinical practice, so more into specialty training. But we have had people that have come in having completed their foundation training where they can make a strong case.
Thank you, Tom. And maybe one more question for you too is just wondering if you can speak about the visa requirements.
Yeah, thank you. We have, as mentioned earlier, students that join us from all around the world. But an important point is that because we are a part-time course, the visa regime is not one that would allow you to spend time permanently in the UK. Other academic courses from Oxford and other universities are full-time courses. You'll be given a student visa, and you would come and live in the UK for the duration of your studies. That does not apply to either of our courses because they are part-time. So you will be able to get a visa to come in for the taught component, which runs for a week in Oxford. And many of our students will also expand that to stay for a week before or after in association with their studies, and that's not problematic. But it's important to bear in mind that we won't be able to sponsor a student visa to live in the UK.
Wonderful. Thank you so much, Tom. Pippa, maybe a question for you is there's a question about the demographic in the classroom, and particularly about the professional careers, interest areas, backgrounds, and where they went as alum. So I don't expect to quiz you on the details of each person in your cohort, but just wondering if you could speak a little bit about who you were surrounded with and maybe if and how you stayed in touch.
Sure, thank you. Yeah, the in-person courses were great. There was about 20 people in my class, and from all over the world. It was quite fascinating. There were really people from everywhere and every surgical discipline, which was great. And the conversations when we got into doing some of the hands-on workshops and comparing the different healthcare authorities in our various clinical areas and where we lived was very interesting. We had a WhatsApp and continue to have a WhatsApp group for each of the different courses. And from time to time, people still just reach out. So it was very diverse. And there were some nurse practitioners and clinicians. There were some also, I think, an administrator who had done more sort of change management clinical work. It was very diverse and very interesting. And the course really fostered a team approach. There were also some after hour get-togethers and drinks and things. So by the end of the week, we were all very familiar with each other. And the demographics of timing in career, there were some people who were quite early on in their career and several of us who were a little bit more advanced in our career, but I never felt that we weren't all on the same playing field. It was a really good experience in all three of the courses.
Wonderful. Thank you so much. And actually, a good segue into the last question I have. So I'll say that just to say, if you have any more questions, please put them in the Q&A and chat now. Otherwise, we'll move on to our last question, which, Tom, this might be for you. Pippa mentioned that there was an administrator on the course. So can you talk to us a little bit about some of the non-clinical professionals and if and to what extent they might be interested in this course?
Yeah, thank you. So we do have people who have administrative, that's really to say either a management or a leadership role within healthcare organizations. And again, we've had people at different stages of their career, including pretty senior. We've had two chief executives of healthcare organizations that have taken either the MSc or PG cert. In fact, both I think were the PG cert. And perhaps the most unusual background that we had was a medical lawyer who wanted to better understand the world of his clients. Took the PG Cert a few years ago. Um, so what we're looking for is people that are interested, curious, but also who have roles where they're going to be able to apply what they learn. And that certainly can be because they are people who are in managerial roles, but want and need to understand the clinical pathways, the clinical practices that they're responsible for.
Thank you so much, Tom. And thank you, Pippa. I think those are all of the questions we have for now. So we will bring it to a close. Thank you all so much for joining us today. As I mentioned, if you're interested in getting more information, you can find us online on the NDS webpage. You can also reach out to us directly, ssp@nds.ox.ac.uk. And please do, if you're interested in getting some more information and timely updates, sign up for our newsletter. Otherwise, thank you everyone so much for being here, and we hope to see you shortly.
Thank you, Olivia, and thank you, Pippa, again for joining us and taking the time to beam in from Calgary.
You're welcome. Thank you too.